So often we get some good news regarding anything around Transnet, but the Transnet Phelophepa healthcare train is back on track. That is good news. It's dubbed the Train of Hope. It's currently at the Dube station in Soweto. The idea is to provide a basket of health services to those who can't afford it. Most of those services, we understand, are also for free. We'll get the details on what we mean by most. Let's find out how this is all working. I'm joined by the Gauteng MEC for Health. It's Nomantu and Nkomo-Ralehoko making time for us this morning. MEC, hello to you. So back on track, it's good news. A lot of people were asking what happened to the Train of Hope. Was there a problem with it? Good morning.
Yes, Gerald, I think there was, it stopped at some stage, and then now they are resuscitating it in Gauteng. They started here with us, which they have arrived on the 9th to the 13th of October. But again, on the 16th and the 20th, they'll be here. They're stationed here for those few days, just to give the health care services that they've been doing before to the people of the province and the country.
And let's talk about the services that it offers, MEC, as well. I didn't want to give too much away. For those who don't know, what sort of services are being offered on the train?
They're offering healthcare education. They're offering child immunization, so that parents should bring, there's the card that we call the Road to Health that we're using. They must bring that card. They're offering cancer and diabetic education, diabetic screening and cancer education, pap smear, prostate and breast screening, medicines. We're providing them because they have a pharmacy on site now with a team that is distributing those medication, eye tests. They have glasses that they provide you on the spot, and because we're pharmacists, definitely will get some services. So we have a fully fledged eye clinic in the train, but it doesn't include the operations. Or if you need operations, they refer you. They provide again counseling and psychology. So all those services that I've indicated are available. They are there, but now we've partnered, including the dental clinic. It's fully fledged there. Screening and there are extractions that are doing, fillings, they're doing them, and cleaning of the teeth. And there are procedures that at least you pay a minimum amount of, like, for example, if you want to get the eye drops, they charge you R5, but if you don't have that R5, they will give you for free. So those are the services that we are doing but we're partnering with them because of the number of people that went to the train yesterday and day before yesterday. I had to bring in now the services of the province, which are similar to the services that they're doing in the train. So we have the same spot next to their clinics, have our own clinics that we've opened as provincial government to ease up the pressure that they're having.
And the nice thing about it is it's mobile. It's a train. It can move around as well, which is very, very clever. Where does it go to next? How do you decide as the MEC, as the health department, where this train moves on to? Who's making those decisions and how are you making the decisions?
Because we're collaborating with them, already I've negotiated that the train, when it moves, it must go to Citibank. Then from Citibank, it must take Ekurhuleni, then moves from Ekurhuleni to Tshwane. So they are agreeing, but it's going to take time now, those negotiations that they're doing, because they said they're moving in all the provinces. But I'm appealing to them that because it's already the service that we're doing even ourselves in the Tish communities, as you are aware that Premier Sufi said, we must go to townships and informal settlement and hostels. So this service is beefing up our service that we are doing on a weekly basis in the province.
Could you see, perhaps obviously not right now, I imagine there would have to be budget discussions and planning and logistics. We could get more trains of hope. Though right now it's only one, but this seems like a very clever idea because often we hear, MEC, don't we, that those in rural areas don't have the transport to get to clinics far, far away. I mean, it's such a clever way of doing it. Could we see more trains like this in the future? Is that what you'd like to see?
That's what I would like to see, because I'm negotiating that we must have more trains that are providing these services to communities, because it's quite interesting. And you remember, Garrett, I've been doing it with the mobile transport now, those trucks that are moving around. But now this train is beefing up that number. The number of people that I've seen yesterday and day before yesterday, it's huge. It was like 1994 lines when we were going for voting. And people don't want to live there until they get the services. Hence, I felt that we must beef up with what we have. But if we can do that train everywhere, in the whole country, in the whole province, all healthcare services, people will reach them. Even this 5 rand or 10 rand in some of the services, like for spectacles, they will say 30 rand to get the glasses. If you can afford, if you can't, they're giving it to you for free. People are not even having a problem to take out that 10 rand and get the area that they're supposed to get it without being free. Then nobody complains, and it's quite interesting because even NGOs now are partnering with us. There are those that are feeding people whilst they are sitting there in the train. So there are those that in fact, I said to them, let's broaden the scope now and do even some exercises, although we don't have enough space, so that there's some activity that we are doing whilst we're waiting for the train. To get inside the train, because it's stationed, you get inside the train, it's a fully fledged clinic. It's quite interesting. The classes, they are doing them there. Those the part of the classes that's assembling them. The assembly, it's being done on the spot. When you get in, you get out with your classes.
It's a very, very easy and quick way for people to get the help that they need, and it's a mobile way of doing things. And MEC, you said it's going to be at the Dube station, if I heard you correctly, from the 9th to the 13th of October. So it's currently there until the 13th as well. MEC, as I start saying goodbye to you, though...
Sorry, Karen. My apology, Gareth. It's from the 9th to the 13th, and then there's a break of 2 days, 16 again to the 20th. They are back again on site.
At Dube station?
Yes.
Okay, thank you for that. Okay, thanks for the clarity. Just as I start saying goodbye, MEC, been very vocal, and I do need to get a comment from you just on this Matthew Lani issue. I know charges have been laid by the department against this bogus doctor, but you've been you've been very straightforward with this. There's questions asking about the vetting of new doctors coming in and how we're supposed to trust doctors with current qualifications. What are you telling South Africa this morning? Why should they be trusting doctors working for Gauteng Health?
We've been vetting doctors, and we're still doing that, Gareth, including other officials that are being employed by government, which is a standard procedure that is being done. But this Matthew Lani, although I don't want to talk in detail about it because I've opened a case for him, he picked up a card, maybe it was lost, for an intern that is working in Tembisa. And then he was using the identity card that is not his. So I think that's why they then loitering around Helen Joseph Hospital in the corridors there, pretending to be a doctor. So I think that's the mistake that we have done then, of assuming that already once you have an identity card, you are in the system, you have been vetted, because you can't have our card without vetting it. But if it's a person that has just stolen it or found it and then felt that he should be the doctor, then that's what he did. But I think it's something that we will even scrutinize now. Any face that you can see that it's not the face that you recognize, something must be done. But again, there are other plans that we're bringing in place for the screening. When you get in at the door, we look into that camera, and then you are able to know that you are working here. So that, in fact, we are changing the systems in the department. So it will help us, this one. But we've told everyone that is there, if you are inside illegally, you must know that you are going to go to jail. We are clear about that. But it's a really painful thing that people are doing, because imagine if that person was diagnosing and giving medication and treating people, what will happen to us now?
Do we know, sorry, just on that, MEC, do we know of any patients this bogus doctor would have treated? Is there some way of finding that out? Do we know if he treated anybody in the hospitals?
At the moment, with the investigations that we've been doing with the CEO, there are no patients that he has treated. So, but we're still investigating that, because we must go now to the records since he has been there, at the time that he has been there loitering there, because you remember doctors work sessionally. So maybe he was coming there once or twice, I don't know. It's something that we still need to do, because of the investigations that are in place. But it's quite a bad thing that it's critical. It's really bad what this doctor has said, which is not a doctor, by the way.
Yeah, absolutely. MEC, I appreciate the time. And obviously you knew I was going to ask about the fake doctor, because you have been so vocal on it as an MEC and as a health department as well. I wanted to just get that on record. Gauteng MEC for Health, Nomantu and Nkomo-Ralehoko. But the main point of our discussion really was the train of hope for those who can't afford medical care. It is going to be at the Dube station from the 9th to the 13th, and then again later in the month as well. So keep an eye out for that. And obviously we had to check and get the MEC to give us a comment on this fake doctor, Matthew Lani, running around. But the case has been opened up against him by the department, and they're re-looking at their systems. Of course, we'll keep a close eye on that over the next few days.